Beri Beri or vitamin B1 thiamine deficiency, or this question can also be asked as Wernicke-Korsakoff syndrome. Thiamine is found in larger quantities in yeast, legumes, pork, rice, and cereals. Activity: Thiamine is required for carbohydrate metabolism. Thiamine pyrophosphate (TPP) is an essential coenzyme in the conversion of pyruvate to acetyl CoA. This is the bridge between glycolysis and the tricarboxylic acid, that is Krebs cycle. TPP, thymine pyrophosphate, is also the coenzyme for transketolase of the pentose phosphate pathway. Thymine is also important for nerve impulse conduction. Thymine deficiency: cells cannot metabolize glucose aerobically, leading to accumulation of pyruvic and lactic acids, which produce vasodilation and increased cardiac output. There is also less ATP generation. Thiamine deficiency is mainly seen in chronic alcoholics due to poor diet and impaired absorption. Deficiency is also seen in people eating mainly polished rice. Clinical features: infantile beriberi is seen in exclusively breastfed infants of thiamine deficient mothers and is invariably fatal. Dry beriberi mainly affects nervous system and is characterized by peripheral neuropathy with wrist and or foot drop, Wernicke's disease, and Korsakoff psychosis. Wernicke's disease is a triad of nystagmus, ophthalmoplegia, and ataxia, along with confusion. Korsakoff's psychosis is impaired short-term memory and confabulation with otherwise grossly normal cognition. These two are almost exclusively seen in alcoholics with thiamine deficiency. Wet beriberi mainly affects heart and causes congestive cardiac failure with pulmonary and peripheral edema. Thiamine is given at a dose of 50 to 100 mg for 7 to 14 days IV or IM as a treatment. Then an oral dose of 10 mg per day is given until full recovery is achieved. Another treatment protocol is Korsakoff psychosis is irreversible and does not respond to thiamine treatment.